One of the things I've been very impressed about is the long history of DEI efforts towards students here at UMass Medical School. So in my role as Assistant Vice Provost, I have the privilege of overseeing the Office for Outreach Programs. And some of those activities have been ongoing here since the mid-1970s. So we have this really rich history of pipeline programs to enhance diversity in the biomedical sciences and health professions that really goes back to the early days of the institution.
I would love for 50% of our students to be diverse because I want them to reflect the population that they will be caring for in 2030, 2040, 2050.
A unique thing I think that happens here at UMass is we have what's called a Student Government Alliance. And that alliance is a student group that is across all three of our graduate schools. And they have created pillars for action. And one of those is a diversity pillar. The students are highly committed to a diverse and inclusive environment, and they're highly committed to helping us get there.
We're very proud of the leadership that our students have shown in pushing us to be a more inclusive institution.
We are very struck, I think, by all of the really horrific things that have happened in our country, not only just in the last couple of years, but in the last 300 years, as long as the United States has been in existence. However, sometimes it's easy for us to be, I would say, a bit tunnel visioned about what we see. And the students have brought forward several issues that they see very clearly, much more clearly than we do. And they're able to bring those forward in a highly professional way and help us create solutions that are win-wins.
We have a great range of student groups in all three schools focused on DEI. Those include our Diversity Interest Group and Student SACNAS chapter in the GSBS, the GSNO in the Graduate School of Nursing, and our SNMA, or Student National Medical Association student group, and our Latino Medical Student Association in the School of Medicine, just to name a few. And together those groups really form part of what we call our diversity pillars, affiliated with our Diversity and Inclusion Office. They really sort of help to galvanize institution around DEI efforts.
What I hope has also been accomplished is that these changes are visible to the outside. That when faculty candidates or candidates for admission to any of our schools visit our community, those changes are visible to them, and we present a more welcoming and inclusive community.
I am really pushing for more diverse students to come and be attracted, and we were fortunate enough to get the Chancellor Scholarships, so we have the ability to attract people to come, and I'm seeing our numbers going up as far as diversity. Inclusivity, I think, is all of our responsibility. We have to be inclusive, and inclusive of diverse opinions, diverse thinking, diverse ways of being in this world, and being inclusive and always thinking who does need to be included in the discussion or in the classroom or in the clinical arena.
I think we as a community became more conscious of where we might have failed in the past and what we can do going forward.
The institution has made very significant financial investments in increasing our representational diversity amongst our students. We've greatly expanded our Chancellor Scholarships. They're now available across all three schools. And the impact of that, I think, in our ability to recruit really outstanding students to the institution, I think, cannot be overstated.